This is Waves, a podcast from APTA Michigan. I'm Andy Wicks. We've heard from past guests about how they pour their blood, sweat, and tears into the clinics that they have built, in the hopes that it will be sustainable and a source for good in their community. My next guest lives that every day and then some. Dr. Ryan Wood is co-owner of Forefront Therapy and co-founder of Forefront Community Therapy in Evansville, Indiana. I had the pleasure of meeting him at the 2024 APTA House of Delegates, so you know two of the hats that he already wears. But just wait. We're going to get into the nonprofit world, postgraduate education, professional involvement, and the occasional benefit of naivete. Enjoy.
My name is Ryan Wood. I'm a physical therapist. I went to St. Louis University for my undergrad and graduate school, did an orthopedic residency after a year of traveling therapy, did my ortho residency at University of Chicago. Then moved down to Evansville, where my wife is from. We started pumping out kids and did my Master's of Health Administration at USI, University of Southern Indiana. I had it for 75% off because my wife taught there. So was able to roll with that. So had some good experiences through there. And then I've worked in a lot of different types of outpatient settings. And after a while, we finally made the decision for us to move forward with our own practice. So 8 years ago, we started our own company named Forefront Therapy in Evansville, Indiana, Southwest Indiana. And yeah, I think that's kind of what led then into figuring out open to Forefront Therapy with our three core pillars. The first one is all one-on-one care. So no overlapping of patients, no sharing of patients unless specialization allows, no techs, really going for as high evidence-based quality as you possibly can. Then our second core pillar is education and research. My wife and I are both huge geeks. If we could get paid to go to school, we'd try to figure that out and just kind of keep rolling with it. And we have a nice little up-and-coming research branch to our team. We've had a few studies published, and it's been a lot of fun. We have an orthopedic residency that we partner with Arcadia University. We're starting our OT pediatric fellowship. My wife, her specialty is in pediatrics.
Your wife is an OT.
Starting that up.
Yep.
Yep. And then our last core pillar is accessibility for all. And, we started Forefront when we were in our late 20s, and she was still teaching at USI. So realized quickly trying to hit that mission of accessibility for all as a young family, young professionals, it creates some financial resource challenges, right? So seeing folks pro bono, working with folks with Medicare insurance, working with folks with Medicaid, all sorts of commercial plans. It really does create a lot of challenges. And at that time, I was finishing up my Master's of Health Administration and really got inspired through a lot of different models. Social enterprises kind of inspired me, kind of that Tom Shoe model of, sell a pair of shoes and they ship a pair out to Africa, right, for somebody in need. So that there's a lot of models that we were kind of contemplating on going with. But what we ended up doing is took 2 years to really learn the business of nonprofit, that whole world. And from our for-profit branch, we actually started a whole new organization, and that's Forefront Community Therapy. It's a separate brick and mortar clinic, and that's actually now where we see everybody with Medicaid, Medicare, as well as the uninsured and underinsured. We have sliding fee scale programs that are grant supported for those programs, which it's all, we have support up to folks who are 200% from the federal poverty line. Really proud of that. We've raised over $1.5 million in the past 3.5 years for that entity and to fulfill that mission. And we also do a lot of our grant work, community education. Just got a really big grant partnering with community health, psych, actually in schools. So licensed social workers in school systems through opioid settlement funds. We got $650,000 grant with them to do a lot of neat things, including an opioid symposium, where we're establishing a local conference for non-pharmacological strategies to combat the opioid epidemic, just for provider education. So then around the same time, we also started a pediatric clinic. That's more my wife's specialty. So we have 3 clinics now. 2 are for-profit side, one's the nonprofit side.
It's even bigger than I thought. That's crazy.
So I think, yeah, we have 18 people
Okay,
on the team.
that's fantastic.
Hmm.
So you kind of
Thanks.
buried the lead a little bit when you and I met at House of Delegates. You talked a little bit about the not for profit and for profit sides of your company, but I don't think we got the full picture. But you only had so much time to speak, so I get that. And one of the things, so to give context to the audience, so Ryan, you and I were both. So in addition to everything you do, you also serve APTA Indiana as a delegate. So add that to your add that hat to the pile of hats. And
Sure.
so we were both at House of Delegates in Kansas City this year, and you got up and spoke and talked about the issue at hand was about payment is oftentimes a hot button issue anywhere within, I think, physical therapy. But APTA House of Delegates spoke about it a lot, and you were talking about these kind of alternative payment structures, and I think that's the segue that you used to talk about the forefront community and your ability to provide care. Or I think you used that accessibility for all pillar as one of your talking points, which I think was great. Catherine and I both talked with Ryan Shelton, who runs Philanthropy PT in Kentucky, has a very similar, I think, kind of approach and idea. And I was just really interested to kind of hear more about, how do you make this work in a world where reimbursement, everyone is trying to squeeze more juice out of the lemon, and I mix my metaphors. Everyone's slice of the pie gets smaller, and the lemons don't. Whatever. I'm losing the metaphor, but
No,
it's
you're doing it well. Yeah, I get you.
reimbursement rates are not rising, and certainly not keeping pace with cost of living increases and this and that. So as a business owner, and Catherine is also this, she runs her own practice as well. So the two of you are in this world. I am not, but I'm always curious to hear how people balance that. I have to keep the lights on. I have to pay my staff. I would love to make a decent salary and get paid what I think is an appropriate amount for my services, and at the same time be able to provide care for all. So, how do you
Right.
reconcile that? How did you end up where you are?
Yeah. That's a strong, loaded question, which I love. We could go down so many paths on that one. So I'm actually on our practice and payment committee as well. That we have right now it's 3-person committee, and we actually just won a pretty great battle with Medicaid. In Indiana, they actually raised prices where we're getting the Medicare fee schedule without the 3 unit, without MPPR with
Okay.
Indiana Medicaid, as well as we just got them, and this happened 2 weeks ago, but we just got them to actually lighten the burden on prior authorization demands, which is going to be great to see this come into fruition because that'll really change the landscape on so many of our
Yeah.
administrative burdens and talking about like how do we lower overhead and how do we keep the doors open while still making an attempt at a
Yeah.
healthy margin, right?
That's awesome. Congratulations.
And I can get on to, oh, thanks. It was an awesome team. And we have a practice payment specialist, which we're really proud of, that our chapter actually, staffs. So it's Drea Lau, she's been fantastic. But yeah, and then, on the other side of it, you've got some commercial groups in, local in Indiana and national as well. But, for small private practice, you have groups that are paying flat rates that are at times, 300% less than what hospital-based outpatient is getting for the exact same service.
Crazy.
We just have the data for this. So, there's a reason that private practice is struggling, and there's a reason that private equity groups in hospital systems are gobbling up private practice across the country. It's because of these massive discrepancies. In Indiana alone, we're the fourth highest paid in hospital outpatient reimbursement, and we're the fourth lowest paid in private practice reimbursement, and compared to all the different
Oh man.
states, right? So it's just there's a lot of issues that kind of set us up to have to get innovative and have to get creative. My wife and we went to St. Louis U, like I said, as a Jesuit university. We were both blessed with amazing upbringings, with really grounded, solid family, which kind of inspired us on a lot of different paths that we ended up taking. So it kind of got drilled into us. Then we were in El Paso for one of our traveling assignments, and just seeing the discrepancy at times of individuals who have and have not, and then going up to University of Chicago, and it was a Trauma One Center, South Side, where we served, folks who were homeless and addicted to drugs, and they were sitting next to the waiting room next to a Nobel Prize candidate. So I think just these experiences that we've had kind of led us to then deliver these core pillars and really
Yeah.
make it a foundation of why. So, and I commend folks that love that cash-based route. I think it puts a cap on the amount of people that you can serve, of course, and the population that you can serve. But everybody's got their own right, their own path. So I don't think there's anything wrong with that at all. It's not like we have our nose in the air thinking we're better than cash. It's just for us, we have just a different priority of our why. But we still have a home, we still have 4 children, and we had loans that we had to pay off. We have a life that we want to live. So we tried to really figure out, I guess going back to your question in a long-winded response on how the hell do you figure this out on doing this all? But that is what led us to then the nonprofit side.
That's fantastic.
Due to some technical issues, we had to do some pretty heavy editing on this one. At this point in the recording, I asked Ryan what the timeline looked like from the start of their for-profit side to where they are now.
So we started it in 2016, our for-profit side, and it was about probably 3 years in. And we actually ended up pulling the trigger on the nonprofit when about 7 months into the
Perfect
pandemic.
timing.
And we go big. My wife got her doctorate in OT while I was doing my MHA at the same time while we had 2 kids. We have a tendency to go really hard and then crash and then try to figure it out and then do it again. But no, so then we worked on it. We had so many amazing things kind of fall into place, right? So it took 2 years of doing Board Source has a nonprofit training. We have a local foundation that puts a ton of investment into nonprofit as well. So I did a year-long nonprofit training. And then a really big bank is headquartered in Evansville. It's called the Old National Bank. And they sponsored us as a DEI initiative. So we received 96 hours of free legal service to even start the nonprofit. Yeah, it was awesome. But even with all that, it took about 2.5 years to actually develop it while we were running the for-profit side. So we started that 3.5 years ago was the groundbreaking, the clinic opening. And we've got this really cool old building downtown built in the late 1800s that we renovated. Took a couple $100,000, but it's been amazing so far. So it was a few years before we really had the capacity because running a 501c3 is just, frankly, it's harder than running a for-profit. People think it's easy, right? They just dole out money left and right and you just keep rolling, but it is not that way. It comes with a lot of really strong challenges. You have to create a board. You have to figure out fiduciary responsibility and reporting systems and thank yous to every single donor and fundraising events and grant writing. I took a lot of different courses on. So it was a lot of really good life lessons.
Yeah, I bet.
But it was not easy.
I am relatively new into academia, and grant writing is something that I haven't even touched yet because it's just I know there are. Thankfully, I don't think I'm going to have to dive too deep into that world, but man, oh man, it's like a whole other advanced degree on stuff like that,
There's a reason that there's full-time grant writers out there all over the place. But for us, luckily, we have a lot of passion in what we do. We have a lot of evidence that, we work on evidence-based practice, and a lot of our community health and education initiatives are also education-based. And I think they're, thoroughly supported when you think about the opioid epidemic, right? It's getting worse. It's not getting better. So there's a lot of funds, there's a lot of initiatives behind that. There's a lot of foundations wanting to support that and be a part of the change. So a lot of it that we've learned, it's actually just being able to tell a story. So it's not necessarily, NIH type of grant system, right? In terms of application and grant writing on that level. A lot of the times what we have found a lot of success with is local foundations, city, private foundations, even partnering like with Old
Yeah.
National Bank. There's a lot of local foundations and charitable trusts that are under the radar that don't have websites, that they literally have a
Yeah.
four-person committee that it's very much who you know and how you get your foot in the door, and do your mutual interests align. And if they do, then you can say, okay, like how can we partner versus how can you give me
Yeah.
money, you know? So that it's, I think the grant writing that we do, it has it has been somewhat, I don't want to downplay it. I think it's been a little bit more intuitive for us because of our passion and because of the steps that
Hmm.
we took to get there than if I tried for an
Yeah.
NIH grant. Like I know I'd be blown up on something like that, right?
Yeah. It sounds like
Um,
you're
uh,
playing to your strengths. Maybe isn't the right term, but you're being strategic. Yeah. You're looking for people who are
yeah.
like-minded and probably want to help. So.
And the best thing that we ever did was get smoked on a
Yep.
Robert Wood Johnson Foundation grant. It was a 65-page grant application for a 3-year
Yeah.
multi-level proposal. It was as we were getting started. I actually told my wife still in the hospital after she delivered our third child that we were going to apply for this, and it was due in a month. And she is a trooper because she tolerated me. But long story short, long story short, we didn't get it. And it was the best thing looking back, right? Because we were able to learn so much and, have to figure out like, what are all of these things that they're asking? How do I create a grant budget? How do I figure out all of these different levels that normal grants ask? And then you can copy paste a lot of that stuff that
Yeah.
we failed on and then just update them better, more and more each time, and grow off of it.
Yeah.
So it was a wonderful
You failed
fail.
up. You failed up.
Yeah. Yeah.
So I guess I have a question, and again, this is someone who does not work in the private practice world, and so you can both tell me that this is preposterous if this is preposterous, but how do you get more private practice owners, however you want to say it, to get involved in this not-for-profit world?
So I get mocked all the time, actually at House of
Really?
Delegates, especially because a lot of the folks, yeah, 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 late night at the bar,
Yeah.
you're networking and relaxing after a long day. And I get mocked all the time. People think like we're taking money under the table or that we're frankly just full of shit, that it's actually operating well. It is ironic. So the private practice world, if they do it, I think it would have to be some sort of like research evidence that demonstrates this being successful, which I actually wouldn't
Sure.
blame them in that, right? But I will say, right, some of it was a massive investment. I mean, we believe in what we're doing. You look at nonprofit hospital CEOs and they're making six
Yeah.
or seven figures at times, right? So it's not that nonprofit cannot
Yeah.
make a profit. It's a tax exempt organization. But in saying that, I did not take a salary for the first 3 years of all the CEO and grant writing and everything that we did, right? And we
Yeah.
actually put money into it. So we really, and that's without equity, because nobody owns a nonprofit.
Yeah.
It's community owned. So you can never sell a nonprofit. So when you tell a private practice owner
Okay.
that you're operating a non-equity without a
Yeah.
salary,
Okay.
a lot of people then
Yeah.
kind of
Well, I
scoff at
can
you,
see that.
right?
Like, so this is something I just continually pour money into, and
But, for us, can you look at yourself in the mirror better? Are we
yeah.
fulfilling our mission? And is there a moment when you start taking a salary? So this year I've been able to take, a marginal salary, which I don't mind even sharing because I think you could probably go look it up as a nonprofit. You find our records, but it's $60,000 a year now. So, and we have our for-profit side. So you could argue a 3-year investment then to be able to
Yeah.
take a fair salary, on the back end, and that grows. So I probably put 30 hours easily a week into the nonprofit. So it's not like it's
Yeah.
not justified. But I think to your question on how do you convince private practice owners? Well, I think that our for-profit also, and I hope IRS isn't listening, I think we gain benefit through
Yeah.
community good. And I joke about the IRS isn't listening because you know what? It helps our
Yeah.
brand. And people then hear what we're doing for the community. So the way we set it up, it absolutely helps our mutual brand. And hospitals do the same thing. Nonprofit hospitals, they
Yeah.
have they have foundations. Universities have foundations. Banks have massive foundations. Banks on average make a 35% profit margin a year. If I went up to a private practice owner and said you can make a 35% profit margin, I'm pretty sure that they would have like a stroke. Because to have a 35% profit margin, if you're treating one-on-one and not like
Yeah, you're not
treating
triple,
24
quadruple
patients in
booking.
a day, right? Yeah, I mean, anybody can make a lot of money in that route, but I would even argue your turnover is probably going to be so high that your margins are going to slip on the back end. I think it's false. I've worked in clinics like that. I had 34 patients in a 10-hour day doing traveling therapy. Um, Now I billed them each one unit, and at times was threatened to get
Yeah.
fired, but
Well,
that's okay. Yeah, but and you know what? Those honestly, the even that owner was a great guy. It
yeah.
was just their model, because what he was doing was not illegal at all. I just didn't necessarily agree with it with how
Yeah.
he
And
practiced.
it seems that you're not only are you seeing all these patients at once, but like your soul is just dripping out of your ear, and then it's you
Oh,
got
I was
left.
sweating, man. I was jumping over tables. I was young. I was running around. I was in my early. I think I was 23 at that time. Yeah, I was flying around. That was
When I worked in
memories
the
there.
clinic, my background's in neuro rehab. If I had 6 patients in a day, that was a busy day.
That's all right. If we have some people on our team and we're
Yeah.
all one-on-one, right? So some of our folks that are we
Hmm.
hired them out of school, right? And they did a residency, things like that, or not even. I think there's a matter of
Sure.
relativity and perspective. If you haven't worked at a place that has, I'm not going to say bled you dry, but that has put
Yeah.
you through the ringer, it is sometimes hard to see grass is greener and appreciate what a one-on-one model can be. Because, like you said, even the 6 in a day. But I will say, I've worked acute rehab, spinal cord
Yeah.
injury, floor stuff like that. That's
Yeah.
physically intensive, and it's not like you were seeing 6 people and
No,
sitting
no, no,
around for
no, no.
4
Yeah.
hours. I mean,
6-hour long sessions, and then yeah. But still,
yes,
yeah, yeah.
exactly.
If I get to work and I saw my schedule was just you know three 1-hour sessions in the morning, 3 1-hour sessions in the afternoon, I'd be like, oh god.
Yeah.
I was, yeah, I admit I was a lightweight in that regard. A little dramatic.
At this point, we asked Ryan, how do you typically structure your days in the clinic?
Hey, our ortho team, we do 40-minute treatments, 60
Yeah.
minute evals, right? Our pediatric team are 1 hour sessions,
Yeah.
just period, eval or treat. And we give some time after lunch. We give some time at the end of the day for documentation catch up for our peds team. I mean, it's a
Oh gosh.
physically and
Yes.
emotionally, just the demand compared to adult. It took me a while to finally bite that because my wife kept trying to convince me of this, but I haven't seen it
Yeah.
more. I mean, it's there. If everybody shows up, it's a long day.
I also want to talk. So you mentioned that you have an ortho residency and
Hmm.
an OT fellowship, up and coming OT
Up and
fellowship,
coming.
and so and
Yeah,
you.
working on the OT fellowship right now. We have 2 people on our team with a pediatric specialty. My wife was actually the first
Wow.
in Indiana to get hers. Just
Yeah.
brag on her. But yeah, so we've
That,
been working on that. We probably have a year or
okay.
two to get that underground. And we actually partner
Yeah.
with Arcadia for our ortho residency, which we love. Actually, the residency director that I was underneath at University of Chicago, Molly Malloy, is the residency
Nice.
director for Arcadia. So we know how she runs it. We know her quality. Um, I trust her with anything. And we always hit probably 40% over the bare minimum for
Hmm.
mentorship hours. And we just invest
Yeah.
heavily in our team. Um, Ehlers-Danlos Society. It's an international society on the EDS hypermobility. So we're international specialty center of
Wow.
excellence. So we got that about 2 years ago. We were in the first
Okay.
cohort, and so we have a big hypermobility and complex chronic pain program as well. So that type of patient population just needs
Yep.
more mentorship than your
Sure. Yeah.
standard, I'm stiff and rolled my ankle, right? Which we get those patients as well. We love all. So that's how we kind of do that operation. We provide all the on-site mentorship, and
So
then
that,
they
yeah.
run the didactics.
So I find that fascinating that not only do you have this, you have your for-profit side, which, and forgive me if I'm being a little reductive, but we'll call it, your standard clinic. Then you have your
Hmm.
your not-for-profit community clinic, which is, I mean, it runs, it's a clinic. It just has a different financial model.
Yeah,
And then you
yeah.
also have these educational pieces as well. And you already talked about how your one of your pillars is that evidence-based practice. And that, to me, that's a walking the walk kind of a perspective. It's like, yeah, we want to have all the latest and greatest, but you're actually out there. You said you're publishing studies. You've got the residency stuff. Why aren't other companies doing this as much?
Well, I
I
can't
know, I
talk
know.
on them. I don't know. We're a little crazy. I mean, that's very kind of you. We like to think we walk the walk. I was actually recruiting somebody today at coffee, and I invited her because you hear
Yeah,
you pitch it, right? I mean, recruiting is probably the thing that it's a challenge for me at times because I don't like to try to sell somebody on what path
yeah,
they're going to lead their life, right? But I do believe in what we do and why we're doing it. And I do want to get quality people, but I don't like it. Sometimes it feels slightly manipulative that you're taking like these green individuals and you're like, no, trust me, what we're doing actually is
yeah,
walking the walk and talking the talk. So I did. I invited her to come shadow for a half day. Uh, and I said, that way you get to know if I'm really
yeah.
full of crap or not, because I could be saying all these things. And honestly, I've interviewed during traveling therapy and all the different places I've worked, clinical rotations. I mean, I've probably had over 20 interviews as an employee. There are many people that
Oh
are
yeah,
full of it, and they'll pitch you something up front. They'll pitch you all this mentorship. They'll pitch you a work-life balance. Then you get there and it's like, you have a full caseload by Friday,
yeah,
and it's like, just
yeah,
push the gas pedal down. You're like, okay, so this is what it's going to be like. But I think for us too, the ability for us to do these things has been because we've focused on slow organic growth. In 8 years, we have 18 people on the team. Could we have put 50 grand into marketing every single year and grown to 5 clinics and hired a bunch of new grads and like work them to the ground for the first 3 years and
yeah.
just
Oh yeah.
burn and churn, right? We totally could have, but uh, I, probably the proudest thing that we've ever done is get such a
Yeah.
quality team together. We have, I forget, we just had an OT just get her specialty. So now we have over 50% of our team with board
Wow.
certified specialties and 2 more taking boards next year. So for us, when the PT population is what, like 9% have their specialty, roughly. So that's probably the thing we're most proud of is just having a really quality team because then it allows like all this really cool stuff where we can do, we can write a grant and we can do 6 different multidisciplinary educational seminars to
Yeah.
geriatric folks. We just did that with Arthritis Foundation last year, or we can do a cool weekend thing with EDS Society. I mean, having a great team, I think, is the foundation of why we've been able to pull the trigger on some of these cool
That's really,
initiatives.
I mean, it sounds just, as you said, very deliberate about the path and the growth that you wanted to undergo, and not going the route of, we're going to build as many clinics as we can right away, and we're just going to staff them full of rookies and triple book.
But I guess once again, not to overstate, it's
Yeah.
not been easy, and it's not like, I guess what, 8 and a half or whatever. It's easy to say these things
Oh yeah.
looking back, but then my wife, who's in the kitchen right now, is probably giggling thinking about me waking up at 3 in the morning and not being able to fall back asleep and writing notes on a notepad that she bought me because I would just stay up all night
Yeah.
thinking about stuff. Or I used to have a forehead, now I have a 5 head,
Hey,
or I
come
got all
on.
these
We
white
don't need to talk
hairs
about
coming
that.
in. Yeah, catching up,
Yeah, Catherine, you
and
look great.
yeah, there you go. So, but it is. I mean, It's not without sacrifice. And there were many weeks where I was working 70 hours. And my wife has made so many massive sacrifices as well. And so I think sometimes, because we just did a podcast about a month ago, and they were asking about like
Yep.
advice for new graduates about going into your own practice, because that's the thing, right? Like, I should start my own cash base. I should live in a van, and I should drive around just treating people. And it's like that, without that mentorship,
Yeah.
without, like, we would have, if I hadn't done the residency and learned, been a sponge from such brilliant people. I was the dumbest person by far in the entire clinic. It was amazing. But without those steps, I don't think, looking back, like, I have the sweat equity, but I don't think I would have had the quality to back up what we're pitching. So I think there's just so much that goes into it. And same thing with the nonprofit. I mean, we would have failed if it wasn't like
Yeah.
2 years of prep and a lot of divine intervention. I mean, I've got a lot of stories of stuff about getting grants at the right time. And I mean, it has been, a lot of work, but a massive blessing along the way.
Fantastic. I think it seems like you guys, you did your homework. You certainly didn't dive in, naively. Well, maybe you did sometimes, but you at least it seemed that you went into it with your eyes open and recognized, like, this is not going to be an overnight success. This is definitely going to be something that you need to invest in.
Well, yes. And I think we are not, I'm fiscally conservative, right? So I really, obviously we started a nonprofit, so socially pretty liberal. But, fiscally, we didn't ever want to really risk our family life. So we were able to start the company while my wife still had full benefits and working at a state university, right? And, it was 8 years before she left the university position to join the team full time. I mean, she just hopped on board probably a year and a half ago. It was 8 years on.
She's like, I want to make sure this ship's actually going to float before I jump on.
Well, yeah, right. I mean, it's a big one. So 3 years ago, she said from the kitchen, 3 years ago, that was in our colicky fourth kid surprise COVID baby time. So I kind of blur that into 1 year. But it does. I mean, it is, naivety goes a long way, but I don't know, even if I had eyes completely wide open, I think it's been worth it. But going back to it, it's like, what is your intention? Is your intention to become a multimillionaire? If it is, you should probably either leave the profession or like fully commit that you're going to work 70-hour weeks for probably 10 to 15 years. And then you can become a multimillionaire if you can pump out 20 to 30 clinics and sell it to a private equity company, right?
That was a similar message that Ryan Shelton gave us. Is like, the model exists for making a ton of money in private practice. It's just not the model that he chose to follow, and it sounds like that's not the model you're choosing to follow either. Yeah.
No. And I think, like I kind of do, everybody has their own path. And, our people are even in that model, which I think with healthcare, I don't think it's the best quality that you can deliver to people. So I think that we're maybe doing a disservice for probably that 25% of the population that really need, maybe even 50%, but really need that higher level intensive treatment, right? But I think there's, I respect them because at the end of the day, they're entrepreneurs. It's a quasi free market, our healthcare system. So you have every right to be able to move forward with that.
So one thing I want to reiterate, and I'll say it as a challenge maybe to anyone listening as well, but like, how do you motivate people to stay as involved in all these different facets of the profession like you have? So again, I already mentioned you got the not-for-profit aspect, that meeting your community's needs and meeting the needs of those regardless of their ability to pay. We talked in previous episodes with Catherine. I do have it pulled up on my monitor, so it's not off the top of my dome. But Principle 8 of the APTA Code of Ethics talks about, I'm going to read it here, physical therapists.
That's an academics. That's
Yeah.
an academic
Well,
right
she
there.
called me
Yeah.
out in a previous episode. She's like, "Do you have that memorized?" I'm like, "Yeah, of course I have all 8 principles of the Code of Ethics memorized." No, it's right here. Physical therapists shall participate in efforts to meet the health needs of people locally, nationally, or globally. And these subcomponents of it, essentially to say, we need to treat people regardless of their ability to pay, is one interpretation you could say.
Yeah.
Okay, so you have that aspect of it. You have the education aspect of it with your studies, with your residency, with this new OT fellowship that's in the works. And you have also your involvement through APTA. Is it APTA Indiana? Is that what you call it? Because we have APTA Michigan. I know not every
Yep.
chapter has jumped onto that branding yet.
Yeah. We're not in APTA anymore.
Okay.
Yeah. We're APTA Indiana.
So,
yep.
yeah, in APTA. It kind of sounds like a new prescription drug.
Fair flow. I know.
And we all have the same 24 hours in the day, so it sounds like you might have a few extra. But where, how do we, how can we help motivate people to be more than just the staff PT who just sees their patients? Which I don't want to cite. As soon as I'm saying it, I realize it sounds like I'm minimizing, and I don't mean to.
I was going to say
we've been there, and it's important. We need people to do that. But if the APTA vision was realized, I would say we wouldn't see that very often. We would see people who are practicing clinicians but are also doing all these other things. I know that's a pie in the sky utopian perspective, but I'm just curious, how can we make this bigger?
Well, that's part of a pitch of actually how we recruit. So we actually, part of our benefit structure actually is we pay state and national dues as well. So we really force people on our team to participate in APTA. And some people still, even though we're paying for it, maybe aren't utilizing or as active, which is fine. We can't actually force them to be present, even though we're actually considering it. If we're actually considering that they're going to be mandated to at least attend one district meeting, a year, if we're going to pay for the dues,
especially if it's a local drink, as they sometimes are,
Right. Actually, so our director of education, Brian Grant, he is the president of our local district. So I'm proud of that. So I kind of, we try to push people to be present. And I will say, even looking back to it, the lobbying efforts that we've had through the state of Indiana, there would be no forefront therapy if we did not get direct access. We were one of the last states to get it, and we still do not have unrestricted. Yeah, one of. I think we're like the 5th last.
I believe Michigan
something
is
like
the
that.
last. I know.
Yeah,
that's a different story.
So you can talk with some of our team. Yeah, but we now have 42 calendar days, and we had 24 when we actually opened Forefront. So for that right there, even because my first year at Forefront, it was like 93% direct access. So yeah, we have 2 main orthopedic surgical groups in town. They both had pre-existing, like 20-year pre-existing relationships with PT practices. And of course, it's like go down the hall, sort of deal, right? So I knew we were not getting any of that. They had athletic trainers at every high school. I knew we were not getting those. So we had to really, really drive off of quality. And I mean, I was showing up to, I was showing up to like Chamber of Commerce meetings, networking meetings, where I was going direct to small businesses and knocking on the door. Part of our business plan was like a geographic analysis. So we set up in downtown where there were no other clinics. So there was everybody said downtown Evansville was dead, but there were 12,000 commuters that came to work within a half-mile square radius. And what that even allowed, which we had no foresight of this, right? So this is some of that naivete helping out in the back end. Yeah, but I treated so many CEOs and CFOs and high-level administrators at these really strong, profitable organizations that ended up then partnering with us when we started our nonprofit. And the running joke was I was the PT of the stars for a while, and I thought it was kind of like ridiculous. But it was like the Evansville CEO stars, right? So they all talked, and that was the direct access piece. And Evansville is also unique. It's like everybody wants to help. And we have a massive family on my wife's side, like I mentioned earlier. So without them, I'm pretty sure her family made up injuries for us to treat.
Oh, I hurt my shoulder again.
Not
Oh no.
unethically. Yeah, luckily they are all dehydrated, super tight German Catholics that do get hurt a lot and genetically or, hypomobile as it gets. So, but I think, you know, I kind of got
That's
off
fine.
topic there a bit, but, how do you keep people involved in what the challenge of what you said of being even a staff PT for so many people is
Yeah.
so overwhelming. And I think, for us, I love reading research on burnout and strategies to avoid burnout because I've had burnout myself. My wife has had burnout. I mean, I've probably had 3 different rounds of burnout, and I graduated in 2011. So it's not like I've even been out of school
Yeah.
like that long. I think 13 and a half years or something. So, but I think for us, having the for profit and the nonprofit allows differentiation in roles as well as differentiation in clientele. So, what we pitch is, if you have a massive passion piece, we can apply for maybe a local grant where we can have 5% of your time paid, not just all pro bono, to serve. And that's one thing, ironically, that I'm not a big fan. I really don't believe in pro bono work. The only pro bono program that we actually have are for folks living with homelessness. Now, we have a $12 session if somebody is below, the
Hmm.
federal poverty line. So that's about as cheap as it gets compared to like
Yeah.
$160 hourly, like flat cash rate, right? So we do offer heavily discounted, but I think there's something about like the investment piece. So I think like APTA, like this push for pro bono and even student run pro bono, I mean, it's admirable, but I think that sustainability
Yeah.
piece isn't there because at the end of the day, people are getting burnt out. And when you're asking them just to go do more
Yeah.
pro bono like work in the community, you're just going to get more burnout. I mean, yeah, it feels good. You can look at yourself in the mirror, but that doesn't pay the bills
No,
also.
it doesn't.
So for us, it was finding out a way to get corporations to partner with us, to maybe get people who have, we have expertise, right? Some people have financial resources, some people have time. So, where can you partner with folks to then serve and fulfill your mission and really then lead up to that
Yeah.
eighth ethic or code of ethics, right? Where we are serving everybody regardless of their ability to pay. Well, maybe there's a model that can go. And for us, a tax exempt organization also does take away state and federal income tax. So it does lower some
Hmm.
overhead for us where we can then serve that mission. Now, if we have a profitable year, we can't take a bonus. We have to turn it around and put it back into the mission.
Yeah.
But we're good with that.
It's interesting that you talked about the
But it's
idea of
hard.
like we can apply for a grant to essentially offset and give that person some time to dedicate to this passion project, because that's how it works in the academic world, is that you can, you apply
Yeah.
for a large grant, and that's going to help essentially offset some teaching load and allow maybe the university to pay for an adjunct to teach this class instead. And it's interesting that I've never even considered that in the clinic world.
Right. And I think for us, it was such a blessing to like walk into that. I can't say that this was something we knew about coming out of school. We like knew, right? I mean, there's a lot of different ways that like got us down this path. But I do. I think it's just such a no, it's so much work in the reporting. I swear on some of these, like even really small grants, the reporting is so much harder than it is even on the large grants. We had one that's like, you know, $3,300, and it was pretty in depth,
Jeez.
multi-step reporting process, and which I really appreciate. They're proud, but that's also more administrative burden. But it's good. They want to be good
Sure.
stewards of their money too. But yeah, I mean, if we can figure out, because like you said earlier, reimbursement's not going up. It's not. And I think somebody said Medicare, we're essentially at the same reimbursement rate that we were in 2008, not
Oh, jeez.
inflation adjusted, right? I mean, so we're essentially inflation adjusted like 40% lower than what we were making for Medicare in 2008. So yeah, how do we do that? And how do we combat
Yeah.
hospital rates compared to private practice rates? And how do we combat large commercial entities like commercial insurance entities that are making billions of profit a
Yeah.
quarter? they're taking out of, you have low premiums. That's why these like high level corporations are taking them over and getting these plans. But then what it does is it kills you on the back end. And they're taking it from the providers. That's actually
Hmm.
who's getting hurt. So that's why a lot of these companies with these, like what looks like low premiums, like their reimbursement rates for
Yeah.
providers are trash, which then if you have either a naive private practice or a private practice that's owned by like private equity or with the mission to just make money, well, then they accept those low rates. They double book or triple book or quadruple book,
Yeah.
and they pump and grind, and then it hurts. So then you're stuck in this, yeah, you're stuck in this cycle.
Yeah.
And oh, big time.
Yeah.
Yeah. So I think, so how do you avoid burnout? That's why honestly I participate with lobbying efforts. That's why I'm on private practice. That's why I do policy and payment negotiations and things like this. I mean, because if we don't figure out reimbursement, then we can't get paid what we need to get what we have, like to live an
Yeah.
actual good, healthy
Yeah.
work-life balance, or to get innovative with cool practice models, or do like true multidisciplinary types of treatments like we want, or be able to do 5%
Yeah.
research even in the clinic if you want, because then it lowers feelings of isolation and burnout. So there's a lot of ways to overcome it. That has been what's nice about the nonprofit is our biggest thing is it allows differentiation of role, but that it's not the solution. I think I even said that at House of Delegates. This is a short-term solution. This is a band-aid, essentially allowing us to divert resources while the system right now
Yeah.
continues to cut. I hope Medicare and Medicaid don't go under, right? Obviously. But if Medicare keeps cutting, I don't see, or, they're forced to apparently. So I don't see how that some of this is sustainable.
We can only solve so many of the world's problems,
So I don't have
right?
an answer.
We can only solve so many of the world's problems.
Yeah. But I think for us, this model allows us to be half glass full, and it doesn't always have to, like, this is where I think like all of this mission to serve, regardless of one's ability to pay, ends up falling on the shoulders of the practitioner. That's why it's in the
Yep.
APTA Code of Ethics, right? So, but what about corporate America? It's a great stat, right? So all of the donations to the nonprofit world, not just healthcare, like all nonprofit across the board, what do you think corporate percentage of the pie is for those donations? If we break it into three, like foundation donations to nonprofit, corporate, and then
Okay.
individual, like what do you think corporate represents that pie?
I would say half.
Right. 5%, right?
Okay.
So for us, we're trying to figure that out. We're trying to think about strategies on how can we get innovative, and we're working on a couple really cool projects to get corporate buy-in on why physical therapy is so important and why we're going to help them on the back end if they help us serve on the front end.
Yeah.
And even tax demand and getting government to figure this out, like lowering
Yeah.
disability rates and lowering Medicaid healthcare utilization. I mean, all the research that's going there, but none of this research is actually being developed specific
It's
to the underserved and specific to that type
it
of
comes
healthcare
down to
economy.
showing someone why this is worth their while, which oftentimes means why is
Yeah.
it financially worth their while, and sometimes that path is a multi-step path, but we can usually tie something in. But
Right.
it's unfortunate that has to be the path, but money talks and bull walks. So,
But that's part of the
yeah,
storytelling,
exactly.
right? That's part of the storytelling is and not pretzeling. You're not trying to convince them. You're essentially finding out what their mission is within their organization
Yeah.
and how can we align, right? Because if that's not part of their mission, we've tried, you're not going to
Yeah.
crack that nut. And maybe you like treat somebody that's on the board or something and you convince them to like throw us a bone here and there, but it's not going to be
Yeah.
a sizable amount. It's really not. But I think innovation, right, is like, okay, how can we change some of that? Or for us, yeah, how can we spread the word for folks to start nonprofit branches? It doesn't have to, like, I will say, not everybody has to not take a salary from the
That's
beginning.
probably, see, I wouldn't lead with that.
I just didn't, yeah. I, well, naivety does go so far. And if we mislead, then
Yeah, I
it
suppose.
doesn't help, right? It's like, oh man, that sounds perfect. I'm gonna start a nonprofit.
I don't
They're
want to
like,
get paid
wait,
for the next
what?
3 years.
What do you
Let's
have
do
to
it.
do? You have to go into three figures of debt to start a clinic like this because you're having Medicare and Medicaid and
Oh
sliding fee
man.
scale programs. But yeah, my wife and I, we just didn't want this. We wanted this organization to be sustainable. We would rather have a salary, years 3 to 20, than have a salary from one
Yeah.
to three and a
Yeah.
fail at three. So part of that's investment. All private practice owners invest
Sure.
back into the organization. So it's a
Yeah.
sacrifice. It's just how you envision when you can kind of draw back on that sacrifice.
Ryan, normally I would allow our guests to climb aboard a soapbox and rant for a while. Um,
You're like, you've
I don't
already
want to
done
deny you the
that.
opportunity if there's something else that you really have been wanting to talk about. You've been hitting us with a
No,
good hour's
no,
worth so far, though. I love it. But I also want to be respectful of
yeah,
your
no, I
time because you do
appreciate it.
have 4 young children, and I imagine you got to go to work in the morning like the rest of us. So, where can people?
Yeah.
Where can?
And Deadpool and Wolverine did come out for
Oh,
on to
that's right.
Disney
It
Plus, so
did.
that's important as well.
Yeah.
Yeah.
Where can people
Yeah.
find you, find the clinic, find out more about how you're doing the amazing things you're doing?
Well, I am 95, so I've never been on TikTok or Instagram or
You look
X
great for
or
95.
Twitter. I am on Facebook that I look at every once in a while. Ryan Wood. Our organization, yeah, Forefront Therapy. We have Instagram and Facebook. We do have LinkedIn as
Okay.
well. I'm on LinkedIn. You can follow us on those. We do a really good job, as all small businesses do, to kind of ignore our LinkedIn platform. And then we like do 5 really good posts in a week. And then we kind of ignore our Facebook for a while. And then we're like, oh, yeah, we got to market. So, but those are the big things. Our website is forefronttherapy.org. We have monthly blog posts where we're going to start providing some more of this information out there, not only nonprofit specific, but also some of our specialty stuff like EDS Society, the Specialty Center of Excellence stuff, some of the research we're doing. So we're even debating rolling on a podcast, but I got to watch it because I do get a little wordy on my soapboxes, as you have heard. But we've kind of debated on maybe opening up on either, yeah, the nonprofit, for-profit type of model, and or kind of that
I think
hypermobility
you
world.
got
I think that'd
you
be
have
really fun.
some good things to talk about and some unique perspectives. So, you know,
Yeah, thanks. Yeah,
so anyone who's out there can find Forefront Therapy. It's
thanks.
yeah, I think you will do well to reach out to them and just learn what they do. And what?
Oh, I do have a
Yes,
soapbox.
do it.
How about this?
Okay.
Quick one. Support your PAC. So many people do not understand the state and state and national dues for your chapter and your association. They do not go to a political action committee, right? So many people do not know that. I didn't even know that until I was treasurer of APTA.
You're like, wait
Indiana.
a second.
Seriously. So we did an initiative where we cut our dues by $10 to really boost and say, hey, we'll cut your dues, put that $10 to the PAC. But all of these lobbying efforts, and folks, it's so important that you really understand this about political action committees, because we wouldn't be able to even have this podcast conversation, because Forefront would have failed if it wasn't for lobbying efforts and the legislative side. It's so important, and associations like the Chiropractic Association and American Medical Association, I mean, they're blowing us out of the water when it comes to actual resources to move some of these efforts. So there's my 1 minute.
No, we just had Catherine and I were both recently at the APTA Michigan Fall Conference, and that also came up about the coffer size between the PT PAC in Michigan and the chiropractic one. And what we did, which I thought was really cool, and I don't know if Indiana does this, we can sign up for recurring donations, even as low as like $5 a month. Hey, it's a coffee, just toss it, and it's like you can set it up. It's automatic. You don't even have to think about it. And if I can't remember what our president said, but it was like if every member did that, just did a $5 donation, like our bank account would essentially like quadruple in size of the year, like something. So it's
Right.
like it doesn't take a lot. We have the
Yeah.
good fortune that Julie Rogers is a state representative from Kalamazoo, and she is a physical therapist. So she has been been helping spearhead this bill all the way through. So
That's a massive asset.
Sure
Yeah,
is.
That's
Thank you,
great.
Julie.
Yeah. Tag her and she can fast forward just till the end
Yep.
just to get a shout out. Yeah. Doesn't you hear any
Yep.
of that crap before, but we're grateful for you, Julie. Yeah.
All right. Well, thank you, Ryan, so much.
Yeah. No, I appreciate it. Thank you all. It's
You
great
as
meeting
well,
both of
and
you.
enjoy your evening.
Dr. Ryan Wood is the co-owner of Forefront Therapy and co-founder of Forefront Community Therapy in Evansville, Indiana. But that's just a part of who he is. You can learn more about his clinic and the work they do at www.forefronttherapy.org. May he inspire you to do more. Waves is a podcast of APTA Michigan. This episode was produced by Joey Lapidi. We can be found online at www.aptami.org or on social media at APTAMIWaves. Come say hi, we'd love to hear from you. Remember, if you are a PT or PTA in Michigan, you can earn PDR credit towards license renewal just by listening to Waves episodes. See the show notes for details. As always, thank you for listening, and may your documentation always be done on time.